So you are talking on a very, very relevant subject of pudendal artery stenosis for male erectile dysfunction. Sir, is this artery stenosis a part of the atherosclerotic disease?
Yes, actually it is. What happens is, if you see the causes of male impotence, the commonest cause of male impotence, if you exclude the psychological or hormonal cause, is a cause of decreased blood supply to the penile arteries, and that leads to a poor erection. Now the major causes of those are endothelial dysfunction and atherosclerosis. So either of those, if there is an endothelial dysfunction, the arteries fail to dilate and actually supply enough blood for erection, or if there is a blockage, the blood cannot flow in because of the blockage. So these are the two causes. One of them is treated by medicine, the drugs like PDE5 inhibitors like Viagra, and the other is treated by an angioplasty. And this is a new treatment which has now come in the domain of interventional cardiologists, and I think probably there are only 3-4 centers in the world which are doing this.
Is this also preventable if we are trying to prevent cardiovascular atherosclerotic disease spectrum? Does that also helps in preventing erectile dysfunction kind of?
Absolutely, it does. It actually does. And what is very interesting is that you start having male impotence, different degrees of problems with the erection, about 5 years before you have manifest coronary artery disease. So today, if somebody has an angina, if you really get into the history, most of them would have erectile dysfunction or failure of adequate erection at least 5 to 10 years prior to the manifestation of coronary artery disease. That means it is because the etiology is same. If that is one of the symptoms which comes before you have a heart attack or angina, and since the cause is same, it can be prevented. That means you need to have a proper lifestyle, you need to control your diabetes, blood pressure, you need to control your lipids, and you need to have preventive programs like exercise and positive mental attitude to prevent this, and stop smoking, because all these are the same risk factors which produce manifest coronary artery disease or strokes.
So how are the results of stenting in these procedures? Are they able to get back to their normal life after that?
Yes, sir, that's a very good question. And this has been actually studied in one international trial, which is the ZEN trial, which enrolled about 50 patients of pudendal artery stenosis across 10 centers in the United States. And what was seen is there is a response rate of about 80 to 88%. We are the second center doing this, and we have done in fact more cases than the patients enrolled in the ZEN trial, and our response rate is also close to 90%. But what is important here is you have to very carefully select your patients, and only in those selected patients that you have good responses. You can't do it for anybody. Suppose somebody has a pudendal artery stenosis but also has severe psychological depression. In those sort of situations, even if you treat the blood supply, the patient still would be impotent. Okay. So it's very important to selectively select your patient.
The selection of the right patient will be very, very crucial before.
It is, and we follow a big protocol for that. And once you go through that protocol, it is simple.
Is age any barrier for this procedure, sir?
No, age is not a barrier. Actually, this disease is more common in middle-aged, and it sort of becomes more and more common as the age increases. So age is not a barrier for treatment. Actually, it is, as the age advances, you get more and more patients with this problem.
What will be your two key messages to people who may see this patient? Probably a physician, maybe the first point of contact for such patients. So what will be your key message to them?
Two key messages in the last 3-4 years when I'm practicing this sort of a therapy is, one, do ask your patient about the erectile dysfunction, because most of the patients do not want to talk about it, and most of the physicians do not ask for it. So unless you ask them upfront, you will not get to these symptoms. Secondly, if you have these symptoms, not only that you have you should have an idea that this is treatable. So it has to go and undergo an evaluation, and it can be treated, and the patient can be helped. The second thing is also work up these patients for coronary artery disease and stroke. So these patients are usually having atherosclerosis in multiple vessels. So the physicians have to be careful. If they have this symptom, they have to be careful for two things. Not only that they treat it, by referring it to the proper consultant, but they should also start looking at coronary artery disease, which could be hidden at that stage.
So more of a holistic approach has to be done, and not just the treatment of erectile dysfunction should be targeted.
No.
Thank you, sir. Thanks a lot for joining and sharing your
Thank
views
you very
with
much.
us.
Very nice
Thank you,
talking
sir.
to you. Thanks.